I'm Alan Gordon. I'm an addiction psychiatrist, and since 1990, I've been in various leadership roles in teaching and treating patients with alcohol and substance abuse. Problem drinking says what it is. Someone has problem drinking. But knowing if the person is physically dependent on alcohol and need detox is more complicated. And it is determined by the fact that the body that has become more used to a certain amount of alcohol to sustain its equilibrium. And it's almost like a diabetic needs the right amount of insulin. You take it away suddenly and you throw the body into shock. Detox is not rehab. Detox is stabilization. It's just getting the brain calm enough, focused enough to learn anything and to not get sick. It's the sort of what I'd like to call of going from drinking to thinking. In the context of family court or a situation where a person who might be alcohol dependent has reasons to minimize their drinking, to try to put on their best presentation, very often they're not going to say quite how much they drink, how often they drink, and how much of a problem it is for them. If you demand that someone stop drinking in order to spend time with their children, they may feel that they have no choice but to stop drinking suddenly. To meet the demands of the court, you are a prime risk for going into severe withdrawal. A lawyer shouldn't really mandate medical treatment. You can recommend an evaluation for medical treatment. If you can get access to a medical evaluation and the signs are there suggesting this is a high-risk person, that's what you should do. Get a medical evaluation for detox. Combining that with compassionate education of the person. Look, you're not going to be able to drink, but you may suffer. If you're having these symptoms, you should go to your local emergency department and get evaluated. You might be needing a medical detox. It might be difficult in the legal system to get that information, but certainly you would be listening to, is somebody drinking every day? How much are they drinking? Do they seem to get shaky or irritable or anxious or sweaty if they're not able to get access to alcohol? To what extent will they go to find alcohol? So it is tricky, and it's not reasonable to expect a family court professional to make that determination that they need detox, but there could be clues based on all the information that you can gather that this person is likely to need detox. I know that in reality, it's not that easy to get a good professional evaluation. And your primary concern is that the children are not exposed to a high-risk situation, saying, look, concerned about your drinking, you want to have the children, talk to your primary care doctor and get a medical clearance from your doctor. That medical clearance may not be as comprehensive as one might get in a specialty evaluation, but it would provide several things. It would provide an opportunity for the physician to talk to their patient about alcohol, a conversation that may have never taken place. Someone who went through the whole thing, 4 days of detox and a professionally organized quality rehab, 30 to 40% of them will relapse within 1 year. It's important to know that because you can't see that as a failure. It's been recognized that alcohol dependence, substance use dependence are chronic medical conditions that match the ebbs and flows of all chronic medical illnesses, that it's a brain disease and not a weakness in character. Well, I think that it is a wonderful thing that we do have the ability to know what's going on with somebody and sobriety when children are involved, because I'm sure many times that someone is unfairly accused of abusing alcohol to win points in a custody battle. Soberlink is my best friend. They're a dedicated group, really committed and passionate to the field, and discovered that they had the technology and the entrepreneurship, the willingness, the interest in being creative and finding new solutions. So I've seen it grow. I've seen these monitors be universally accepted by many of the best treatment programs. I use it myself. It's become a very important tool, a crucial tool, and certainly in the family court setting, I'm not aware of another tool that's as user-friendly, reliable as the Soberlink remote breathalyzer.